So today we will also take introductory class for WBC count. Yesterday I was so frustrated getting simple answer from the students. And not only one student, a number of students, they answered some question let's see how you answer. You answer how. I am starting with her. Tell me the normal hemoglobin content. Get up. अरे भाई मैनर तो सीखो. Hey, I know you are Pandits. All are Pandits. Expert in hematology. So let's see. Louder.
Sir, range or content?
Normal average content.
12 to 15 in range in females.
Come here. You. Come here. You.
Sorry, sir.
Similar results I will be getting from others. What is the question?
Content of
Is it too tough? Is it too tough? Simplest question. And that question answer we are not getting. You tell. Normal hemoglobin content average amount of hemoglobin. Go there. Go there. You, yes. Yes. Normal hemoglobin content.
11 to 15.
11 to 15. Go there. He is the only student. He could answer rightly. He told the unit. I repeatedly told you, isn't it? I told you, no? So whenever you will be telling me the value answering, then you have to use the unit. Yesterday, I got the answer. Horrible. 12 millimeter. One student said 12 kg. 12 millimeter, 12 kg, 12 milligram. Some answered like her, like them, no units. And some students said, I don't know. Should not we punish them? You came here to study medicine. So frustrating. I am not asking you the very tough question. The school level question. Yesterday some school students came to visit the departments. I am sure they will be able to answer this question. Come. So, that's why, come, sit. That's why I'm telling we are frustrated because of your output. Still, you are not giving importance to your studies. Whenever you will be doing an experiment, coming for an experiment, prior to that you have to study. What are the relevant questions? You are coming here to attend to count WBCs. So you have to know what is the normal count. What is the range? What it is called? Theoretical knowledge. You came here for what? You have learned something in theoretically. Now by doing experiment, you will prove that. So your prior knowledge is there, theory knowledge is there. Then only you are coming for practical classes, but you are not having. You can't say that what is the normal functions of WBC. You will not be able to answer normal count of what is leukopenia, what is leukocytosis, what are the different varieties of WBCs, what are their contents, percentage amount. So before you come here, so study a little bit. You generate sub-question within you. So I have to ask these questions. You have to be clarified. There will say leukopenia, leukocytosis is seen under these and these conditions. These physiological conditions and these are the pathological conditions. You can ask. Say, sir, how it is such? What is the physiological reason? But you will never be asking any question. Because you lost your inquisitive mind. So studying science is possible and only then when you will be having an inquisitive mind. Janar agroh, to know, jodi na thake, then what's the use? You cannot go. You will be pushed. Hey, you are in MBBS first phase in 2 years. In third year, you will be pushed. We don't want to see your face in physiology department. Then only we will push you after 2 years. I am sure you may not pass, all of you may not pass in first phase. I am sure. I am sure. Because I have seen your quality. Don't think that I have paid so much of money and with this money I will be able to pass. No. Don't think in that way. There may be 1 year gap. 1 year. So again you have to pay. When you will be pay more, then realization will come to you, to your parents. When 1 year back will be there, then you will be annoying. You have to be serious. I am sure you will not, all of you will not pass in phase 1. See you will just see, you will find the results of first the assessment. And tell me, not that I will be doing it intentionally. No, what is about you deserve that much mark you will be getting. I am assuring you. According to your deserve, your skill, your knowledge, we will not deprive you. Those who are having skill, everything, no, out of 20 they will get 20. But they don't know, they may get 0. And this will be reflected, result of this will be reflected in university exam. Because your internal assessment marks will be very less. And you have to be qualified first in internal exam. This percentage of marks you should have, then only you will be qualified to appear in the university exam. I am afraid. I am afraid. I'm telling you. Be serious. Be serious. I have given you simple example of one. Simplest example. This is the quality we are having. You understood? The reality situation? What will happen?
So we are going to have a class on this topic, total leukocyte count. Okay. Leukocyte means WBCs. So what is the normal range of WBC in adults? Okay, in adults it is 4,000 to 11,000. Okay. Now we are going to perform an experiment or perform a practical by which we can guess or estimate the total leukocyte count of an individual. Okay. So okay. What is total leukocyte count? This is the number of WBCs per, what is written here? 1 microliter, okay, or 1 cubic millimeter of blood. See the first, in that table, the first one is adults. The range of WBC in adult is 4,000 to 11,000. You should always mention per cubic millimeter, okay. So in adults, it is 4,000 to 11,000, but a child at birth, it is having a range of 18,000 plus minus 8,000, means quite high. Okay, at birth it is quite high, and slowly by age, after the child is when the child is growing, year after year, the range of WBC becomes less and less, and it becomes fixed at 4,000 to 11,000. You see, the range is decreasing: 6,000 to 15,000, 5,000 to 15,000, 5,000 to 13,000, and at the end it comes to 4,000 to 11,000. Okay. In pregnancy, it can be raised till 15,000. Okay. In pregnancy, any stress situations, due to the release of some hormones in our body, like cortisol, like adrenaline, okay, due to the release of some hormones in our body, the WBC count may increase. So the range of WBC in pregnancy is quite raised up till any stressful situation, like even in parturition also, in lactation also, in menstruation also, there is a bit increase in
when there will be in stress.
In stressful situation, there will be increase in WBC count. Okay, next slide. Okay. So, what do you mean by the term this leukocytosis? Leuko means WBC, cytosis means increased in cell count. More than 11,000, we are going to say this condition is called leukocytosis. Okay, there can be two causes, physiological and pathological. Physiological means without any disease condition. Normally, in some condition, the WBC count may increase. Okay.
Muscular exercise, is it a stress? Is it a stress? Yes or no? So there will be increase in severe pain, high temperature, pregnancy already told.
And at birth, actually, the cell is formed from liver, from the entire bone marrow. So the entire cell count is raised. Not only WBC, you will see in RBCs also. We have told at birth the number of RBCs is increased. Okay, RBCs are also increased, WBCs are also increased at birth. Okay, dhire dhire it comes to normal level.
In pathological condition. So what are the physical? So we during Viva we may ask. Tell us 2 or 3 physiological conditions in which leukocytosis is seen. Are you ready to answer?
There are more conditions you can see in the book also. Okay, more conditions are there.
If you are able to answer, immediately we will ask question. We will follow the next question. Why? Why it is increased? What is the reason? So be prepared for that. And now the pathological condition. And try to learn the physiological reasons.
Okay. So in pathological conditions like in infections, any inflammation, any cancer, malignancy, that is like leukemia, severe hemorrhage, there would be raised WBC level. Okay, there is a proposed theory why this during infections or inflammation the WBC count increases. Okay. WBCs have two poles. One is the central pole, one is the sequestered pole, that is means adhered to the endothelium of this blood vessels.
Inner lining, endothelium means inner lining. So some WBCs remain adhered to the inner lining. They are not flowing through the circulation. When needed, they will be coming
They
out.
will be coming to the circulation. Suppose in circulation the level is 4,000 to 11,000, but similar concentration of WBCs are adhered to the selectins. Selectins are molecules present to the adhered to the endothelium of blood vessels. So whenever there is infections and inflammation, whenever there is a trigger for raising of our WBC level, then it will be released and sent to our circulating pole. So at that time, if we calculate, the value of WBC will be increased. Get it? Okay, suppose 4,000 to 11,000 are normally present in the circulating blood per cubic millimeter. Okay. Similar concentration of WBCs are adhered to the endothelium of our blood vessels. Okay. Suppose in some conditions like in infection, inflammation, or any this malignancies, okay, this WBCs will be released from the selectins. Okay, they will come to the circulating pole and there will be increase in WBC level.
Sir, I have got a question
Okay, sir.
on behalf of the students.
Okay, sir.
The question is, why the WBC should increase?
Actually, WBC should be increased.
So you are not asking that question? Why not RBC? Why not platelets? Why WBCs?
What is the function of WBC?
So you know the function of RBC. So what are these situations?
Any
So the body has to fight back.
foreign
Who will be
substance, anything that is not
That's right.
required in our body that needs to be phagocytosed. So who is doing the phagocytosis? Neutrophils, specifically neutrophils and monocytes. Okay, monocytes form the megakaryocyte. Sorry, monocytes form this big cells that help actually phagocyting the foreign substance or the bacteria, virus, whatever substance is there. For phagocytosis, we require that monocytes and neutrophils. Okay.
Sir, I've got another question.
Okay.
Monocytes, I was telling, it's the biggest blood cells. So they fight
Macrophage, right?
infection going out of the blood vessels.
Exactly.
How come? How it becomes possible? How they can leave the blood vessel? Do you have the answer?
अभी बोला ना, they can change their shape.
What is this? This process is called? By changing their shape, they can come out of the blood vessel. What is this process?
Yes, you are telling right. Say.
Come on, tell.
बोलो जोर से बोलो.
Dia? Everybody could learn? I will ask.
Diapedesis.
The-
DIAPE. Diapeda. PEDASIS. Diapedesis. Okay.
The phagocytic cells can come out like that. Because they can change their
That's right.
shape like amoeba.
Monocytes can become macrophages, right?
Diapedesis.
PAE maybe. Okay.
এইভাবে একটু এক্সপ্লেন করে দিন দেখবে যে খুব ইন্টারেস্টিংও হয়
So you are getting the reasons why WBC needs to be increased, not increased due to some other, like उसको increase होना पड़ता है. Okay, they need to be increased to fight the conditions. Okay, next. Next is, what is this term called? Leukopenia. Below the normal level of leukocyte. That means less than 4,000 per cubic millimeter. What can be the conditions? Conditions can be some specific bacterial diseases like typhoid, paratyphoid, and viral infections like influenza, mumps, chickenpox, hepatitis, protozoal infections like malaria, megaloblastic anemia. Megaloblastic anemia means vitamin B12 deficiency anemia. Okay. Aplastic means? So they will know it. Achha, okay. Then in some drugs or radiations, all are affecting the bone marrow. The bone marrow are the principal site of formation of WBC, RBC and platelets. Okay. So if some foreign substance like in some drugs, some chemo drugs, and also some other drugs like chloramphenicol, like aspirin, they have a negative impact, or they decrease or they causes suppression of the bone marrow
activity.
Okay, so this will cause in decrease in the formation of the blood cells, including WBCs. Okay, so you have written it down. Okay. Okay. Now we're coming to the practical methods of calculation of TLC. Similar to RBC count only, here we have two methods. One is automated hemanalyzer. Second is visual hemocytometer method. Okay, we have a hemocytometer, this box. Okay, you have seen now that it contains Newbart's chamber, covered slip, WBC pipette, RBC pipette. Okay, similarly we can calculate by visual method also this TLC, and also electronic method, that is called automatic hemanalyzer, by automatic method. Okay.
Which method you will follow today?
Hemocytometer. That is visual method. Okay, visual hemocytometer method. So I think we have already discussed it in when we were studying RBC count, hemocytometer, hem matlab blood, cyto means cell, meter means count, okay, or measurement. So how will you count the blood cells? So in this condition we are going to count the WBCs. Okay, the specimens, we can either collect the specimen from your capillary by pricking capillary blood or EDTA blood. EDTA blood means stored blood. This is anticoagulated blood. EDTA ka full form anyone knows? Yeah? What is the function of this EDTA? Anticoagulant by chelation of calcium ions. Very good.
EDTA?
He told. What is your name?
What you told?
Bolo.
They don't know. Do you know what is full form of EDTA?
You please say louder so that everyone can listen.
Okay, she doesn't know. Teacher.
Ethylene diamine.
Write it down. Viva question.
The two sources are EDTA blood or capillary blood. Okay. We can go to the next slide. What are the requirements? I have repeatedly told before doing an experiment or a practical, first make sure your requirements are in front of you. Okay, what are the requirements here? Microscope, hemocytometer and WBC diluting fluid. Similarly, like we are using RBC diluting fluid. Can you say, anyone say what was the name of the RBC diluting fluid we are using? You? Decis fluid and Kumud? Asrusha? You forgot? Hems fluid. अभी देखा है ना तुमने? So what are the two name of the two RBC diluting fluid?
Get it. Tell others.
Hems fluid and Decis fluid.
Hems fluid and Decis fluid. Okay. This WBC diluting fluid is called Turk's WBC diluting fluid. Turk's, T-U-R-K apostrophe S. Turk's. Okay. We already know what is there in the hemocytometer. What is there? Newbart's slide with a Newbart's chamber. How we make a Newbart's chamber? Newbart's slide with cover slip is called Newbart's chamber. RBC pipette, WBC pipette. Okay. Can you differentiate between RBC pipette and WBC pipette? Yes. Okay. You say. You. Base.
WBC, I think, keep it bucket.
Not ball, it's called bead. RBC pipette will have a red bead. WBC pipette will have a white bead. Anything more? Stand up and tell everyone. This is the calibrations or markings. The marking or calibrations will be different. Okay. The markings in the RBC pipette are 0.5, 1 and 101. In case of WBC pipette, we will be having 0.5, 1 and 111. 11, 11. Okay, sit down.
Very serious issue. I'll tell you.
Okay, you already know about the Newberg slide, how it looks, the H-shaped groove, the height of Newberg slide. Should always remember the height of this chamber is always 1 by 10 mm or 0.1. Okay. Okay, these are the findings.
একটু দেখো how you will identify WC diluting pipette. How many identifying marks are there? Identifying points? Why not 3? This is 1. This is 1. And the bead white, number 2, and number 3, this mark. What is this mark? What is for the RBC? 101. And for this? So how many points you have? 1, 2, and 3. If I take blood up to 0.5, then by using diluted fluid, I make the volume up to 11. The blood will be diluted? The blood will be diluted? No?
Yes.
How many times?
Huh? How many times?
Huh? First, understand the question.
I have taken blood this, then diluted it up
Till
to
0.5.
this,
You have
up to
taken
11.
blood.
Then
Till
how many
11.
times blood is
You have
being
taken
diluted? How many
fluid,
times
diluting
blood
fluid.
is diluted?
I'm asking, what is the dilution factor? How many times it is diluted? 1 is
How
to
many
11.
times?
No, you are wrong.
0.5. I have taken 0.5 to 11.
तो कितना होगा, कितना टाइम डाइल्यूशन होगा? 1 is to 22. हाँ.
1 is to 22.
Okay, your
1
calculation
is
is
to
coming
22.
1 is to 22. But the answer is not 1 is to 22. Answer is 1 is to 20. 20.
20.
You remember I told something in RBC count also. It was coming 202, but it should be 200. Why?
Oh, because of that. Because like the when it is entering, that part can't be mixed.
Yes, only the mixing occurs in the
But that
bulb area. Okay, very good.
So you will remember this thing. Okay, how many times? 20 times it will be diluted. If you take 0.5 and then make it diluted up to 10, 11, it will be 20 times. But in RBC, how many times you have diluted? 200 times. You have taken 0.5 and diluted up to 101. So that time it was 200 times diluted. Now instead of 101, you are taking 11. So it is 20 times only.
Of the Newberg chamber. So there are our 9 large square. Okay, which are the squares? Large squares. You see?
1, 2, 3, 4, 5. This area should be divided into 4 divisions. But here it is 5 divisions.
5 divisions.
So this is not correct.
Okay, this is the correct one.
What is
Remember,
the distance here? From here to here? 1 mm. Okay, fine. Now I have divided it into 4. So now what will be this distance?
1 by 4 or 0.1
1 by 10. 1 by 10. So what would be the area of this? Area 1 by 10 into 1 by. And what would be the volume of this area? 1 by 10 into 1 by 10 into height.
1 by 4. It will be 1 by 4.
1 by 10.
1 by 4. It will be 1 by 4 into 1 by 4 into 1 by 10.
And 1 by 10. We go to 1 by 3. 0.1.
Yes, sir.
Only 0.1, 0.1, 0.1.
Into 1 by 10.
What is the result?
Depth. Always told now the depth of the chamber is always fixed. It is 0.1
We have
mm.
shown you the gap. 0.1. That is 1 by 10. So volume is volume of one small square. Volume of a square is 1 by 10 into 1 by 10 into 1 by
0.1
10.
it is shown here, no? 0.1. 1 by 4, sir.
1 by 4 into 1 by 4 into 1 by 10. We have divided 1 into 4 divisions. So each division will be 1 by 4. So 1 by 4 into 1 by 4 into 1 by 10. Okay, what is the result? Calculate it.
এটা ক্যালকুলেটর লাগে মুখে করা যায় না বল কত হ্যাঁ কত
Okay.
হ্যাঁ 1 by 160
Some of you are having doubt. So who are having
1 by
doubts?
160.
Please raise your hand.
what are the doubts
Only 2,
stand up
3, 4, 5, 6, and again 7, 8. Okay.
okay tell me what are your doubts
So how can we get that 1 by 4?
okay first of all you need to understand the question sir asked actually see here there is 1 WBC square 1 WBC square 1 WBC square 1 WBC square okay this is the central one is the RBC square you forgot already central one is the RBC square these 4 are WBC squares okay so this WBC square the length you see the entire length is 3 mm okay and this suppose this 3 mm so there are 3 squares so this length is 1 mm it's already written here na 1 mm 1 mm so this 1 mm there again in this 1 mm distance we have equally divided the large square into 4 small squares see 4 by 4 hai na 4 here so sir is asking the volume of this one small square volume kitna hoga?
Volume.
That's what they were calculating
1 by 4 into 1 by 4. This is the area.
then
And
volume 1 by 10
If I consider the height, then I get the volume. So height I know. Height is how much?
1 by
Height 1 by 10. So what would be the volume?
see the height
So this is the volume of one small square. Understood?
okay you saw the height here 0.1 don't forget that okay
Now আবার একটা exercise দিচ্ছি. If you understood how to calculate the volume of one small square, now tell me
Roktem,
what
easy.
would be the volume of this area?
very easy
1 by 10.
You 1 into 1. This is 1. This side is 1. This side is 1. 1 into 1 into 1 by 10. Okay?
1 by 10 তারপর 1 by 10 then what is the volume 0.1 cubic millimeter you should say that okay every time should say the unit only
Okay? Understood? Now tell me what would be the volume of this, and this?
4 by 10.
Huh?
4 by 10 means 0.4 okay
Okay? I have seen 2 WBCs. How many? Only in this smallest division. There are how many? Now calculate. Suppose I am giving you this. In this area there are 2 WBCs. Now tell me what would be the value in per cubic millimeter.
For it.
Not understood?
Sir, rest of the area there are no other.
No, only consider that, na.
The average value. I got the average value of each.
Okay.
Each one.
Point क्यों থাকবে? Count can mean point. Like there are point one cell. How is it
Now you
possible?
calculate.
Sir, আচ্ছা কোশ্চেনটা বলতে
এদিকে
আসো
এদিকে আমার সামনে এলে তো কোশ্চেন বুঝে যাবে।
আসো এখানে আসো।
আচ্ছা এখানে কটা আছে? 16টা। আমি এই জায়গাতে টোটাল 32টা পেলাম।
कितना आया?
তাহলে এক একটা করে এভারেজ কত?
What is the answer?
ভলিউম ডিভাইডেড বাই
তুই এনাটা থেকে পড়ে আসিস না? হ্যাঁ? You are engineer, right? তুমি তো পারার কথা বাকি না পারলেও
আরে এখানে কয়টা? 16টা করতে?
মার খাবি।
16টা
কি
করে
হইলো?
টোটাল কয়টা আছে? 32টা। তাহলে এক একটা করে এভারেজ কত?
Volume of every cell
এটাই
is
বলি।
First of all, শোনো
two আছে।
First of all,
এবার তুমি calculate।
find the volume. Find the volume of the
Hello?
area.
অ্যাকচুয়ালি আর একটু ডিটেইল করে দিই।
Then convert it into
ওই যে this
5
area।
cubic millimeter. बस खत्म।
4 1/4 into 1/10.
कितना आया?
হ্যালো,
1/160.
this area is having 16 squares, small squares. So I have counted all the WBCs and the number is 32. And what is the value for each division? Average value? 2. Now you calculate. That was the question, the problem I gave you. One small square is having 2 WBCs. Now tell me the value. What it comes? You understand this? No doubt, any doubt? Please tell if you have. Okay.
This paper you have seen. Just now you have seen, na? The graduation mark, you know, from 0.5 to 11. There is the white bead. The volume of this bulb area is 10. 11 minus 1, that is 10. Okay. Okay. Now we come to the point where we will know about the diluting fluid. Turks diluting fluid. There is the WBC diluting fluid. What are the components of the WBC diluting fluid? That is glacial acetic acid, 1%.
Learn it. Composition.
Glacial acetic acid and this gentian violet and water. This water is used as a solvent. The use of gentian violet is to color the nucleus of WBCs. Okay, and the function of glacial acetic acid means, glacial means pure. This pure acetic acid ka function is to disrupt or damage the membrane of RBC, WBC platelets. It will damage the membrane. Okay. The function of glacial acetic acid is to damage the membrane of RBC, WBC and platelets. Gentian violet का function क्या है? To
Sir, I have got a question. Question is, why it is necessary to damage the membrane of all the cells?
because if we cannot damage or if we don't like disrupt the membrane or don't take out the RBC, then we cannot see WBC properly. There will be more of RBC.
Because RBC count is, you see, per cubic millimeter, how many? How many? Million.
Millions, man.
Where is
4.5 to
WBC
5.5.
Much more. So that area will be covered by the RBCs only. So it will be very difficult to count the WBCs.
Okay.
So that they are not making any disturbance. So all the WBCs must have their nucleus. Nucleus is there. So if it remains intact, so I can count the nucleus. Its nucleus will belong to a WBC. So one nucleus means
One
one
WBC.
WBC. So in that way, but here no hindrance from outside. I mean other cells will be there. So that's why glacial acetic acid is used.
The nucleus of WBCs have 2 layers. That's why it's not damaged. Okay, but the membranes are damaged easily by the glacial acetic acid. Okay. These are the functions. The functions are important. Gentian violet is used for to color. Okay, to color the WBC nucleus. Okay, it's written here. You can write.
Go through. Because you have to answer.
These cells are counted in low power microscope. Low power means in 10x only. In 5x or 4x, you are going to see the new burst chamber. Okay. In 10x, you are going to do the counting. For RBC also, I think we did it on 40x. Why? Because that RBC square is further divided into very small squares, right? And RBC count is very high. So for that, we need to magnify more. Here we can do the count in low power microscope. Everything that we have discussed is written here.
So one question I got from one student. They were asking ki, she raised this question. Good pertinent question. She was asking, sir, here 0.5 is written, certain amount of, what is this actual, what would be the unit?
There is no unit.
There is no unit.
It's just a marking, like
Yes. There is no unit. So only to how this part, 0.5 part of blood. So this part is diluted into this mass. So you have taken only 0.5 part. You can also take one part and diluted it up to this part. So it has got no unit, it's the parts. Is that clear to you? Okay. Usually আমরা কি করি অনেক টিউশন করতে কতটা নিয়েছি তাতে Okay.
Okay. Next slide.
And one question. I think somewhere we can find cubic millimeter, somewhere we can find microliter. I think these are not same.
These are same.
These are same. 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 Good. These are same. Either you can tell microliter means cubic millimeter. So next. So there should not be any confusion.
1 meter by 1 meter by 1 meter.
কত হবে?
এটার ভলিউম কত হবে?
এটা 1 লিটার কি
1 cubic millimeter? 1 into 3 হয় নাকি?
Okay.
Give a simple example.
Can you go to the next slide? Okay. The procedure. Okay. Procedure similar to the RBC count, total RBC count only. First of all, we need to draw blood, either capillary blood or this EDTA blood. Till which mark? 0.5 mark. Then we have to wipe the excess blood that is in the tip of the pipette. Excess blood is wiped by non-absorbent material. Cotton bhi ho sakta hai, something else, but non-absorbent. It should not be absorbent. Okay. Then we have to draw the diluting fluid up to 11. Up to the highest mark, that is 11. Okay. Then mix the contents in the pipette after 5 minutes. Okay, you can use after 2 to 3 minutes only. How will you mix the blood with diluting fluid? By placing it in between your palm. The bulb should be in between your palm horizontally, and then you're going to do it like this. Okay. For how many minutes? 2 to 3 minutes. Maximum you can do it up to 5 minutes. Okay. Okay. Then why do we need to discard the first few drops? Okay, this part below the bulb, okay, this part of the tube does not contain any blood, only the diluting fluid. So we need to discard that part. That's why first few drops, 1 or 2 drops. Fill the counting chamber and allow the cells to settle down for 2 to 3 minutes. Okay. You know how charging is done at 45 degree. Okay, just touching. You have to charge the chamber. See, there are two chambers, upper chamber, lower chamber. You should charge both the chambers. Okay, what is overflowed and what is this undercharged? Undercharged means you can see the entire chamber is not filled. Some part is still not charged. Okay, or there may be air bubbles. Okay, and what is overcharged? The fluid or the blood mixed with dilating fluid will be overflowing the chamber. No. Okay, got it? हाँ? Previous slide. Okay. क्या जानना है इसमें? You want to write down?
Just the last.
Okay, write down.
একটু আমার একটা instruction, one instruction. It is not written in the procedure. When you will be charging the hemocytometer, you have charged it. Now, what is your function? You have to wash the tube. When your charging is completed, or you have, suppose it may not be proper, so maybe you have to reuse it. So you wait for that. So after completion, you have to wash the pipette. Okay, otherwise it will be like this.
Don't repeat it, huh?
Yesterday, this has been done by yesterday. So not washed. It is your duty. You have to clean it. You have taken, you will find there, it is a fresh one. So while you will be submitting, it should be cleaned on. You have got cleaned tube, everything is clean. Even the hemocytometer is cleaned. So while submitting, it has to be cleaned. So it is your duty. Okay, before leaving, see, we have used this, so this is clean. So we are not at fault. Ensure it.
Okay.
And one more thing. Suppose today is your exam. Today itself is your exam. So what you will be? You will be drawing blood up to 0.5. So what you did? You have taken much more or less. Sir is not there. Let us take it to finish it first. So required amount you didn't take. Okay. So if you do it, so this will be a wrong procedure. So whether you are following the procedure or not, that should be judged by us. So when you are taking the blood up to 0.5, show us, sir, I have taken correctly 0.5. Because 20 marks I have to divide in different phases. One phase is correct pipetting of blood, correct dilution, correct charging. You have been told it at 45 degree angle, there should be some space, free space. You are not covering the whole area by the cover slide, some part should be exposed. So here you will be applying the drop, so that the drop is not spread over the cover slip. It will be spread under the cover slip. So that part is we will also observe. And the rest part will be calculation and the counting. So these 5, 5, 5, 5. So every step there will be mark. So unless we see, unless you show, how can you get those who will not be showing? They will be missing that mark. Any step you miss, you haven't shown us, then the step, mark of that step will be gone. So you have to show. Every step you have to show. So where you will take the precautions? Where are the you have to take precautions? On drawing blood and making the blood diluted. This is another part. Applying, charging, and focusing the required area, counting properly. I don't know whether it is yesterday, today we will count. So there is, come to that way, that slide. Let them count. Yes. Procedure is same. Like upper and right, you exclude. See, we have crossed. Now you count how many WBCs are there. And write your answers. Don't discuss among other students. What is your count?
First count the number of WBCs here and then the WBC count. कितना हुआ? 19. You sir?
20 seconds. No, sorry, 19. Sorry, 20.
He was confident there was
18.
20.
No, it's 19 only.
No, he was confident there was 20. You said 19. So I'm confident there was 20.
What was the confusion?
Now are you having any confusion? You? Now calculate. TLC. Dilution factor is 20. This is given one corner.
What is the count now?
3,000.
Count like taking dilution factor as 20.
20, yeah.
What is the count?
3,800.
कैसे किया? 190, 192. Okay, good. We not count upper and right one. Okay, and the method is zigzag. Okay, like that. That is shown here. Just like RBC count.
We are telling you to count, not to count upper and right. But in your book, some of your books, you consider this and don't consider, just opposite. But you follow,
Only one.
result will be same, only one. So for RBC, we have followed one principle. So here also, we will follow the same principle. Otherwise, at the time of examination, we will be confused. So the same principle we can follow for both the counts. Is it clear?
Okay. So how we have come to the conclusion that the dilution factor is 20. Okay, how? We have taken 0.5 parts of blood. Okay, 0.5 part of blood is mixed with 10 part of fluid.
This is Bible question.
The entire mixing of blood occurs here. So what is the volume here? 10. 10, okay. So in 10 there is 0.5 unit of blood. So what is the dilution? 0.5 in 10 or 1 in 20. Okay. 0.5 is there in 10. So or 1 in 20.
Is that clear to you all?
Counted 150 cells into dilution 20, always fixed. 150 to 20. Volume of the chamber 4 into 0.1, always fixed. Huh? 4 square है ना? 1 WBC square here, 1 square here, 1 square here, 1 square here. Why we are? See?
ये चारों को you count किया ना? You
There
have
are
to
4
count.
WBC square,
You have
right?
to count all this. For using those formula,
You are going to
you have
count
to
here.
know the value of this 4.
This, and this. 4
For
squares.
using those formula, you have to know value of these 4. But you can also, if the value of this 4 is not given, only value of 1 is given, then also you can do it.
You're getting
And
this?
if somebody tells us, sir, this is the formula. So, okay, then we will, why this 4, why this 0.1, why this 20, you have to explain.
This will be asked in Viva also, okay? Practical may this will be asked.
Next. These are the points.
So, okay, now come the other method, that is the electronic method. That we will not be doing here, but it is done in the laboratory nowadays. Okay, this is why this is done. Easy and rapid method. Okay, more accurate, no personal bias, and large number of cells can be counted very quickly. Precision is high. Of course, if a machine is counting something, it's better than us. Suppose already in that counting you say someone was saying 18, someone was saying 19, someone was saying 20. Machine will not say that. Machine will say, okay, the count is 19, 19 only. Okay, so it's more precise.
See, and this is about what? Electronic method.
What
Not
is the method known as?
physical method.
Automated heme analyzer. Okay. But of course, it will be having some disadvantages. Disadvantages like it will be more costly to buy. It is very easy to do it. Okay, less costly. That is more costly. Calibration error. Sorry.
Yeah, one calibration error. So, simple example. You have bought one electronic BP monitor. Very simple, you bind it, switch on. After that you will get value. Your systolic pressure is, what is the normal pressure? What is the normal blood pressure?
Take. कोई नहीं, take it down.
80 से 120 mmHg. 80 से 120. Correct, she is correct. Huh? 120 upon 80. What? 120 by 80. What? mmHg. What is 120? Systolic pressure. What is systolic pressure? What is systolic? Systole means? So during contraction, certain amount of blood will be ejecting into the aorta. So that time, lateral pressure will be more, maximum. So what is this pressure? Systolic pressure during systole. Okay. When this blood will be proceeding forward, the heart is now at diastole. So at that time there is no blood. There is blood, but there is no fresh blood coming from heart. So that time pressure will be minimum during diastole, and that is 80, as she said, 80 millimeter mercury. Okay. So this is the average normal value. 120 systolic pressure, 120 millimeter Hg systolic pressure, and 80 millimeter Hg diastolic pressure. Okay, so you have bought one BP monitor. So with that you measured your BP, and the result came to be, say, 110/70. Somebody is telling this is not correct. Okay, again you measure it. Now this value will not come. Whatever previously first reading you observed, this value will not come. Again you measure, this value will not come. You see there is variation. Same person, same observer, same patient, value different. Now question is whether this value is correct or not. The machine is giving whether it is correct or not. So what you will be doing? Comparing this value with With what? With a standard method. Standard method is nothing that is sphygmomanometer. So now you will measure the blood pressure with sphygmomanometer and then you will compare. If lot of variation is there, then we will say the blood pressure is not total, it is not calibrated. And there, the value that it is giving is not accurate. It should be within, very close to the value of sphygmomanometer. So that's why every instrument should be calibrated with a standard method. We know this mass solvent is having 200 milligram of glucose. Okay, it is known 100 ml of blood, 100 ml of solvent, and we have added 200 milligram of it. So what is the percentage? So this is the. Now I will analyze it with a machine. That machine also should give same result. Then we can say the machine is calibrated. So there are different methods of calibration, but always it should be compared with a standard one. So here also, see in our hemocytometer, or it may be is calibration. These are the lines. It may not be 1 mm from here to here. It may not be 1 mm. It may vary depending. We don't know. There are a lot of manufacturers. How they made it, whether these are calibrated, I don't know. So we are using this hemocytometer thinking that these are calibrated. It may not be. But here you will be using thinking that these are well calibrated. These lines are calibrated. The 1 millimeter distance from here to here, it is, the instrument says it is 1 mm. Okay, we are considering this. You are correct. We are considering. So, but when it will be examined with the calibration purpose, then some error may come. So, we are not going into this.
Sometimes some nucleated RBCs can be counted as leukocytes.
Where? In our
Electronic method.
Where? But in our case, in hemocytometry, no. Because all RBCs were hemolyzed.
Platelet clumps can be counted as leukocytes also. So these are the mistakes that a machine can make. Okay. Now what are the other things that can be used? Other uses of this Newberg chamber, except this RBC count, WBC count, platelet count can be counted. Platelet can be counted. CSF cell can be counted. Normally in CSF means.
She's ready to answer.
Okay. CSF means full form. CSF means.
Sir has targeted me, asking repeatedly same
CSF
question.
means.
So that you study.
Not synovial fluid. Bolo, khade ko bolo. Done.
Done?
Yes, sir. It's coming to the 0.5 mark. Okay.
So maximum of fluid you can carry out. Now
जल्दी करो ना.
it will be stuck.
आराम से take 5-10 seconds more.
Somehow it is wet. Whether you have done it or not. Now you proceed immediately with the sphere. Let's clean on it. Not a spin.
Not yet.
Then you took then
Get out! Get out! Get out! Get out!
हो गया तुम्हारा? हो गया तुम्हारा? Perfect.
এটা